My talk is about setting up and running a local support group. As John said earlier, we know that around the country there are aspirations to do that, and there are some already in existence, but we don't know much about it. And we would like to help that process. My name's Olga. I am a CLL patient, one of your watch and wait patients, diagnosed in 2006, and still watching and waiting 11 years later. I didn't do much for the association I joined in 2008, and I only became a trustee last November. So I was very passive for a long time before I came on board to the association. But one of the reasons why I proposed that we have this topic today is because my background, professional background, is in adult and community education. And so my experience is a lot about reaching out to local communities, finding out what their needs are, and responding by putting on a program to meet those needs. And the other reason is that I was a founding member of my local hospital cancer group. I was a breast cancer patient in 2003, no return of it since, and founded with others this cancer patient group in my local hospital, and learned an awful lot about what is involved in running a local support group. And I also did a fair amount of research nationally to see what works and what are the problems. And so that's how I thought I could become a resource to those of you who are interested in this. So the actual trigger was when I heard from Brian, who's helped a lot in setting up this conference, that Leicester wants to set up a local support group. And I spoke to one of your team sitting right there in the back in the armchair, who is one of the Leicester CLL team, and said, how is it progressing, your plans? And she said, it's still on the starting board. So it hasn't been launched, it's still an idea. So that was the trigger for it. But we know that local support groups meet local needs. The National Association is looking at a national picture, but the needs differ considerably locally, according to what the local provision is, according to the local team, the facilities they have, the treatments they can offer, and the location itself. How rural is it? How urban is it? Is it in a big conurbation? And what are the resources available in that particular area? And it's also, the local needs will consequently vary, and individual patients vary enormously, as do carers. And those two things can much better be met in a local support group than we can nationally. And the other reason, I think, is that local support groups make you feel a hell of a lot better about your CLL. And they give you knowledge about the disease, they give you understanding of it, they also give you the empathy from your fellow patients or carers who've been there, who've had that experience. And often as a result of this, in my own experience, you have a lasting bond with those people in that group. So it becomes a friendship forever. I left off one point, I think, at the end. I'll go back, which is the national attitude to it, which John alluded to at the beginning. We know that as an association, we are much stronger if we've got very firm roots feeding in to what we do, if we've got our ear to the ground of what are the local conditions and needs. We can then campaign much more effectively. And also we can draw upon a wider resource of people who are involved, people like yourself across the country. And that makes us much more effective, gives us a much stronger voice to change things, to improve services. So what in our experience in the National Association do CLL patients and carers want? I think it's probably going to be the same locally. First of all, they want accessible but not dumbed down knowledge. They want it in three areas. about CLL as a disease, about CLL treatments, and about how the NHS system works. I mean, I've never worked in the NHS, and it took me a long time to understand how it works, and I'm not sure that I fully understand now. And any talk that comes from a professional will automatically bring people in, as you've experienced today. The population at large and CLL patients, like the population at large, have enormous respect for consultants, for nurses, and for clinical teams, and they will come to a talk. The other opportunity that the National Association gives and that local groups will also give is an opportunity to meet other patients and other carers. You know that the requirement is that the names and details of patients are not ever divulged to anybody. So we as patients and we as carers cannot know who else is there who's in the same situation as us. We can't recruit. The only people who can recruit and help us are the clinical teams, because they can tell their CLL patients, look, there's an opportunity in Leicester, they're starting up a local support group, why don't you give it a go? Those are the two things that people come for. And after that, the group will evolve according to the needs of the group. And each group will be different. There is no template that fits all. It's just like a talk about CLL and patients. It behaves differently in different people. So do support groups. Now I'd like a little bit of audience participation. As I said, we don't know what support groups are out there, and they may be just fledgling ideas, but we would like to build up a picture of that. So I've asked Brian to act as my assistant and put up onto the flip chart names of any groups that you are aware of, however small. He will put the name up, and then during the course of the day, if you can just add a contact detail and where we could get more information, that will be very helpful. We will then begin to build up a national picture. So I can start you off, Brian, with Glasgow, and I can also start you off with Pauline's permission with Worcester. Permission given. We also know that Leicester is thinking of it. So it may not have got there yet, but it's thinking of it. So we've got Glasgow, Worcester, and Leicester. And in your head, I think, Gail, are you prepared to say what your idea was? Because Gail was talking about a carers group, but it. Right. Right. So just an idea at the moment, London, but for carers.
Or London, just in general.
London. Right. So London. Do we know of any other groups nationally or across the country?
I had contact from at a previous meeting from somebody called Stratford-on-Avon, who I think I can find her details in my said she would be happy to start.
Okay, Stratford-on-Avon. Swindon. Oh, haematology, yes. Swindon. Okay, if you think of something during the day, just add it on the chart, and we'll collect it in at the end of the day and let you know what the picture is nationally. I'm going to rush over all my next slides because I want to finish in 3 minutes. Okay, and this is the final slide. I think probably if you're at the very initial stages, there will be two things that concern you. One is recruitment. And as I've said already, it is impossible for patients and carers to do. You have to get the cooperation of the clinical team to reach CLL patients and carers. The other thing that I know from experience is very difficult is to get Black and minority ethnic groups. They're the most difficult group. And I have experience of working in adult community education, so I might be able to help you if that's an issue for you. The easiest group are the over 60s. So you've got a good group here. I suspect that most of you are over 60. So that is one tip for you. Another tip I will give you is in the research that I did for all of the cancer networks nationally. At that time when I did it, there were 35 networks and 26 of them responded. And I asked them what their most problematic area was, and 26% said recruitment is our biggest problem. And 62% said it was a considerable problem. So that's what you have to get your head round first, recruitment. I won't give you more examples, but I can if you're interested. So what we can do as an association to help you, the other thing perhaps you're interested in is funding, or perhaps I should mention that. I don't think you need funds. I come from a Cinderella area of adult and community education. We manage without funds very often. You will get free speakers. You will get free accommodation in a hospital, in a cancer information center, or somewhere else, an education center. I've used all of those. You will get it for free. Accommodation, speakers. Generally, anybody who is offering assistance professionally will give it for free. Generally, the hospital will allow you to do all your photocopying for free. You may want refreshments, and generally the group themselves come forward with refreshments. We had one in our group who loved baking cakes, and people came for her cakes as much as for the conviviality of meeting fellow patients and carers and the information they got about coping with CLL or other cancers as it happened. We can make help sheets. Some of these are all in my head. So if you ask, I want to help on that particular area, we can put together a help sheet and give it to you. Or you may have something specific to you and your group. If you then contact Sarah Tobin, who is the lady who is out in reception, who is our national coordinator, she will then point you in the right direction and see if we can help you. And there's the contact details, coordinator at CLL Support Co. UK. So one final thing that I think might give you cheer, this association, I believe, started with only 3 people. It's now got 2,000 members. If there is passion for it, if there is determination for it to succeed, and if there is patience when things go wrong, which they will, then you will succeed and you will grow. It's like a 3-legged stool. You want passion, determination, patience. Take away one of those, the stool collapses. But the 3 things support each other and you will succeed. And I wish you good luck.